Hello, this is Dr. Jacqueline with DTP-Leadership Group. You've tuned in to Hot Topic Bold Talk, the podcast where we dive into everything that matters today. Join me as we explore the hottest trends and pressing issues with conversations that sizzle and perspectives that heat up. This is Hot Topic Bold Talk, since every chat has something cooking. Let's dive in to today's discussion. Hello, this is Dr. Jacqueline with DTP Leadership Group. And I just want to let you know that I am improving. I don't have COVID anymore, but I do have some aftermath. So what I want to do tonight is, this is podcast 97 of Hot Topic Bold Talk. The title I've given is Tragic Fallout of Abortion Bans, Lives at Risk in Red States. And I'm going to be talking about Arkansas, because there is some very disturbing information that has come out of that state. As an introduction, I'll say there are too many deaths of women and babies in red states. And so I'm going to start the podcast about the state of Arkansas with the Washington Post by Annie Rowan, which was in August 27, 2024. And you know that you always have my references at the end of the podcast, so they'll be available to you. This state itself says it's the most pro-life state, but mothers there keep dying, and it's a heartbreaking story. These abortion bans affect two groups, women and the children born to them, or the babies. The challenge to maternal and infant health in Arkansas, a state that strictly bans abortions, are particularly daunting in its southeast corner. There in the timber country, Dula Ajami White is among the women trying to help both newborns and their mothers survive. And here is their story. This is from Warren, Arkansas. The preteen had already picked out a name for her baby, already felt him kick, which made the sight of blood in her underwear all the more frightening as she was getting ready for bed that fall night. Her mother, Renoka Lawson, called for an ambulance to take them to the hospital 5 minutes away. As the sirens blazed and the EMTs tried to reassure the 15-year-old, Sharia Lincoln, bad news cracked out of the radio. Head to the next county, the EMTs were told. The local hospital no longer delivered babies. In a state that touts itself as the most pro-life state in the country, where abortion is prohibited except to save the life of the mother, timber country in southeast Arkansas is an extremely dangerous place to give birth, says this article. Arkansas already has one of the nation's worst maternal mortality rates, and the mothers in this area die at a rate exceeding the state average. 92% of the recent maternal deaths were preventable, a state review committee found. In November, 2 hospitals in the region abruptly closed their birthing units, sending patients like Sharia scrambling to find a new obstetrician. And now she was in an ambulance at midnight, speeding through dark pine forests on a tense half-hour trip to a bigger hospital. Doctors were able to get her stabilized and eventually sent her home. With a ride that long, anything could happen, said Imogene White, one of the teen's doulas. When hospitals are turning you away and you have to go on to the next one, any complication can develop. Whether you're in an ambulance or not, you're putting the mother at risk and the baby at risk. Since Arkansas banned nearly all abortions after Roe versus Wade was overturned in 2022, doctors and others have sounded the alarm of what they say is a deepening crisis in maternal health. They point to other markers, too, particularly the state's very high rates of teen pregnancy, infant mortality, and food insecurity. Facing pressure from business leaders and the medical community, Republican governors Sarah Hitchcock Sanders launched an initiative to address maternal health, an issue that she acknowledged we've ignored for far too long. Yet she declined to support extending Medicaid postpartum coverage to a year from 60 days, saying the state's existing insurance system was not enough. It is not. That is a flat out lie. Arkansas will soon be one of the only two states not adopting this extra coverage. So you're gonna hear more about her and what happens. In Warren, White met the news of possible assistance with skepticism. In addition to her work as a doula, she runs a local network for expectant moms. She founded Precious Jewels Birthing Project in 2015, but has struggled to find resources to offer car seats, diapers, and other basics. We're on our own, said White, who is 50 and often teens with her 24-year-old daughter, Gwen, also a doula. Bradley County Medical Center, the facility that serves Warren, shut down its labor and delivery service. It was another painful loss for this very rural area where lumber jobs have dried up and tomato farms have disappeared in recent years. The majority of White's county that she serves, with a population of about 10,100, has lower levels of education and income and a higher share of uninsured people than the state average, data shows. So if Sanders had approved it, then there would be insurance for them. Expected moms already were driving miles for their appointments. Now they flood Mainline's clinic, so many that a new staff hired to do home visits saw individual caseloads quadruple. So Sharia obstetrician Constance Chapman had delivered 30 babies in February, more than one a day. Now, Sharia's baby's father was not supportive. And what I think is sad here is that though teen birth rates are falling nationally, federal data shows that statistics for Arkansas is almost twice the U.S. average. Lack of access to contraception is a major factor. The rate at which teens in Arkansas have unprotected sex is 75% higher, according to a report from the nonprofit Arkansas Advocates for Children and Families. Lawmakers generally have made it harder for teens to get birth control. The advocacy group's report noted school-based clinics need parental consent and can't use funds to provide contraceptives. The state does not require sex education in school. If taught, lessons must stress abstinence, but an hour of adoption awareness instruction is mandated for grades 6 through 12. An hour of adoption awareness instruction is mandated for grades 6 through 12. Topics to be covered include the reasons adoption is preferable to abortion. Sharia's mother saw what was going on with her daughter and the kids around her public housing complex. She was determined to get her a long-acting contraceptive implant, but said she could not find a doctor locally to do the procedure. She finally took Sharia to Little Rock, 180 miles round trip. At a hospital there, she learned that her daughter was already 7 weeks pregnant. This was not a welcome news, since they had many problems that were going on. Governor Sanders has done some outrageous things, such as having an infant tucked under her arm to sign the law that has created this state of affairs for women and babies in Arkansas. Sanders' administration has embraced that the distinction since America's United for Life, an anti-abortion group based in Washington, first bestowed the title 3 years ago. Its rankings reflect states' protection of life from contraception to natural death, with a strong focus on abortion. Her actions are lacking, and Arkansas officials have attempted to have hospitals throughout the state run home visit programs for at-risk moms. Only 4 have been approved. Advocates worry that Sanders' overall focus on cutting taxes signals that she may not be willing to fund any significant projects associated with reproductive health. I've seen this too many times, where Republicans want people to have babies, but they don't want to provide any child care for them or any help for the mothers. And it's gotten worse with Trump and the actions taken by him. 90 miles south of the Capitol, White caught up on the governor's news on her battered laptop at the secondhand appliance store she runs with her husband of more than 30 years, Wayne, a veteran, and a school bus driver. They're well-known civic boosters in Warren, where they raised their 6 girls. She said, "There's resources." Well, where are those resources? Here's the description of what White has to say in her comments. And it's about her as well. Even at midday, her eyes were blurry from fatigue. She works remotely overnight as a resolution specialist, coordinating repairs for Walmart stores, and otherwise maintains a fitful sleep schedule to be available if a mom's in distress. She has helped more than 24 women through their pregnancies. These days, she also counts on 10 sister friend volunteers, deputized as part of the Precious Jewels Birthing Network, to mentor new mothers. Yet White, who holds a degree in early childhood education, has struggled to get broader support. She says she tried to start a food pantry for mothers to be, and it was told by the regional food bank that there already were enough food programs in town. And she says she's been passed over for public and private grants. Ultimately, she bought a tiny house that's parked near her husband's store that she aims to turn into a center for new mothers. It's by the shop, it's empty, but for a loan package of diapers. Since the state's abortion ban took effect, Arkansas has given $2 million to similar crisis centers. Many of them, though, are faith-based. And the legislature recently authorized another $2 million for this financial year. Hope Place in Warren, which is a faith-based entity, relies on private contributions, but a Hope Place Center founded by the same woman in the nearby town of Monticello has received $68,000 from the state in the last 2 years. But we can't give anything to Benjamin White. The previous winter, a Warren woman named Megan Patterson died shortly after having her 5th child. Patterson, 32, had experienced swelling that persisted after she went home from the hospital. She should never have been discharged, said her mother, Patsy Newton. The death certificate listed acute respiratory failure with obesity and heart and chronic kidney disease as contributing factors. Officials at the facility where she gave birth, now called Baptist Health Medical Center, Drew County, declined to make comments. White hadn't been involved in Patterson's prenatal care. Even so, she was devastated by her death. In tears, she called her mentor at the organization where she was trained as a doula. And she said, I boohooed, she said. I felt helpless. I wish somebody would have reached out to me and I might have helped her. Maybe she would still be here with us. Obstetrician Kara Worley, who has worked at each of the local hospitals that shut their delivery units, says women such as Patterson require complex care. She says, I can't remember the last time I had a patient come in healthy, young, with no medical problems and have a baby and go home, Worley said. Though she sees routinely suffer chronic health problems, from heart conditions and undiagnosed diabetes to morbid obesity. Worley and reproductive health advocates believe the state's abortion ban has hurt hospitals' abilities to recruit and retain obstetricians at a time when the number of facilities delivering babies has dropped from 39 in 2020 to 35 today. But you remember, it's quadrupled in the needs that they have. Nearly half of the counties in Arkansas now lack a hospital or a birth center offering obstetric care. From where I stand, White says, lawmakers haven't done anything except make it harder to care for patients, she said, recounting a case when she was required to do unnecessary testing that delayed treatments. Sharia was concerned about going back to school after she had the baby, and White and Gwen and her mother encouraged her to graduate. As it turns out, Sharia would not be the only new mother. At her school of about 500 students, the principal said 12 were pregnant or had just had a baby. Now I want to go to something I think is really important and exciting. Men in red states speak out against abortion bans in red states. So another important article by Emily Wax Tuberdo in the Washington Post on September 2nd, 2024, is a powerful article about a louder voice in fighting abortion bans, men in red states. More men are speaking out in defense of reproductive rights because of harrowing experiences that wives or partners have suffered when a pregnancy went awry. These statements and experiences come from these men. Tom Stovall grew up in a strict Baptist family in Mississippi and always believed that anyone involved with abortion was destined for hell. But his lifelong conviction crumbled when his wife, Chelsea, was 20 weeks pregnant with their 3rd child. Tests showed a severely malformed and underdeveloped fetus, one that was sure to be stillborn if carried to term. There was other devastating news, too. Continuing with the pregnancy could threaten Chelsea's health and future fertility, doctors warned them. The couple live in Arkansas, which we know has a near total ban on abortion, is surrounded by states with their own highly restrictive laws. So they drove 400 miles to reach a clinic in Illinois where they could end the pregnancy. As they did, Stovall says he decided he was dead wrong about abortion being a sin. He began knocking on doors, hoping to change other men's minds and help get an abortion measure on the state ballot this fall. 2 years after the Supreme Court toppled federal protection for the procedure, growing numbers of men in red states are speaking out in defense of reproductive rights because of these experiences they're having, and when the pregnancy goes awry, endangering their health or ability to bear children. Some, like Stovall, had been staunch abortion opponents. Others conceded they'd given no thought to what might hit them closest to home. It's like an ocean change for men, and the conversation has shifted to include men in high-profile ways, said Orrin Jacobson, a co-founder of Men for Choice. It's men with a 4 in it and then choice. The group, formed nearly a decade ago, has intensified its advocacy in the past year as more states criminalized abortion. Florida is a prime focus for them. When we think about our organizing strategy, it's to help men see the harm that such laws cause, including harm to their families. And Jacobson said, it's also to put the issue in a broader context for them. He added, it's not just about abortion, it's about freedom, it's about power. It is an issue that impacts all of us and the women and family we love. The emergence of men's voices in deeply conservative states, several with measures to protect abortion on the ballot in November, has been particularly striking. In a series of posts on X that went viral this spring, Texas radio DJ Ryan Hamilton detailed what happened to his wife, Jessie, during a prolonged miscarriage at 13 weeks. She was refused treatment and sent home by 2 Dallas area medical facilities where doctors cited the state's abortion restrictions. Hamilton said she ended up bleeding heavily for more than 24 hours until she lost consciousness on their bathroom floor. Until then, Hamilton acknowledged, abortion care was not on my radar. He now encourages other men to tell their stories on a podcast he began hosting this summer as his wife recovers. And I think it's a fascinating podcast, and I want to be sure that I get in and listen to it. It's called Correct, and his introduction explains, in the wake of our family's tradition and in the hope of affecting change, I've decided to keep this conversation going. Men have to have a voice and step up on this, he said in an interview. This is not just an issue for women to talk about on their own, and it's for all of us. The results of the latest Washington Post ABC News poll found that 1 in 5 men call abortion a top voting issue for them this year. While it resonates more among Democratic men, with 34% identifying it as one of the most important issues, 15% of both independent and Republican men also say it is one of the single most important issues in their vote. Men have strong feelings about this issue now. Men care about this issue, said Tresha Yundim, a partner with the non-partisan public opinion research group, Perry Yundim, who has studied abortion for over 20 years. The 2022 Dobbs decision that reversed Roe versus Wade has has a turning point. Post-Dobbs, they see this has impacted their whole personal rights and feelings. We heard a lot of that at the Democratic Party talking about personal rights and family rights. Yet connecting the dots between miscarriage care and abortion is not clear to many men, said Greg Donnelly, a national expert on abortion law and associate professor at the University of Pittsburgh Law School. The silver lining of Dobbs is that it forced people to talk about what was stigmatized and shrouded in mystery: miscarriage, fetal anomalies, stillbirth. And I think these things have not been discussed enough by any means. So, Donnelly's view is abortion is now a crime and it's impacting men and women's families in ways that are unpredictable, she said. Men telling their own stories is going to be a big way to change hearts and minds. Some men are also vocally supporting vitro fertilization, which in conservative states like Alabama has been caught in the abortion crossfire because of the embryos created and then potentially discarded as part of the IVF process. The most prominent ally, of course, is Minnesota Governor Tom Walz, the Democratic vice president nominee during the party's recent convention. Walz shared his and his wife's years-long struggle to have a family and what he decided and described as the hell that is infertility. He said he signed legislation as a governor protecting reproductive freedom because in Minnesota, quote, we respect our neighbors and the personal choices they make. And even if we wouldn't make those choices for ourselves, we've got a golden rule: mind your own damn business. In Idaho, John Atkins raced his wife from their home in Caldwell, a suburb of Boise, to Portland, Oregon last year. After ultrasound showed a fetal abnormality so complex that she was likely to suffer potentially deadly complications. Jennifer was nearing the end of her first trimester. I felt like a fugitive, said Atkins, 37, a sixth-generation Idahoan. He remembers local doctors telling the couple that ending her pregnancy at that point would be illegal. This June, the U.S. Supreme Court ruled that Idaho hospitals should be allowed to perform emergency abortion care to stabilize patients despite the state's ban. Now, unfortunately, Atkins didn't have that available to it. What we went through, it violates all common sense, Atkins said. He vowed that day he would never again sit on the sidelines when it came to abortion rights. He has since attended rallies and related community events. I had not really known that miscarriage would be impacted like this. It was really the first time as a man that I realized what this all meant. Travis and Taylor Edwards took a similar desperate drive from Austin to Colorado when she was 17 weeks along last year, grieving the imminent loss of her pregnancy. Tests had shown the fetus had a fatal condition. Texas hospital would not perform the needed abortion, according to the couple, and she endured a dangerous 2-week delay in care. It was absurd what we went through and what others are going through, said Edwards, who's 33. He was raised in a Catholic family that considered abortion evil, but turned away from those beliefs as a teenager. He says, everyone thought abortion is this dirty word, but it was then that I realized it was the end of life care and life-saving care for my wife. He describes himself as so naive before all this happened and says he now is very motivated to get involved in this fight. He was set to talk about experience, including the subsequent birth of a son, at a campaign event for Representative Colin Allred, who is a Democrat in Texas, who is running against Senator Ted Cruz in November. For Stovall and his wife, those from Arkansas, their loss 2 years ago remains painful. After the day-long drive from their home in Fayetteville, Arkansas, they were greeted at the Illinois abortion clinic by protesters displaying massive pictures of dismembered babies. It was barbaric and made me just sick when we were already mourning this very much wanted pregnancy, he recounted on Monday. I was once that way too, thinking you would go to hell if you had an abortion. But it wasn't that simple. I was lied to, said Stovall, 30, who's 30. If I can change, others can too. This is the tragedy for Arkansas. The Arkansas Supreme Court recently upheld the state's rejection of signatures that abortion rights supporters had gathered for a ballot measure to prohibit abortion bans before their first 20 weeks of gestation. Stovall had been part of that canvassing for a group called Arkansanians for Limited Government. He vows to start anew next year. Now, I want to provide you some more important things about this as well. And then there are facts and there are warnings about the overturning of Roe versus Wade. On August 9th, 2024, at 1 a.m. in CNN, there's an article written by John Fritz. Wide swath of America remains opposed to the Supreme Court's ruling overturning Roe versus Wade. Polls find. The Supreme Court's 2-year-old decision to overturn Roe versus Wade remains unpopular with a wide majority of Americans, according to a poll Friday that landed as Vice President Kamala Harris hammered on reproductive rights as a centerpiece of her campaign for the White House. Two-thirds of Americans oppose the High Court's abortion decision, according to the new Marquis Law School poll. The second half of the article is about the Supreme Court. Nearly 6 in 10 respondents in the latest poll said the justices' decisions were motivated mainly by politics, compared with 40% who believe their decisions are based mainly on law. A Pew Research Center poll Thursday of the same week reached a similar conclusion, with 51% of the respondents holding an unfavorable view of the courts. There's one of my favorite newsletters I want you to know about is 314 Action Funds. And in May, they had a message that was from Barack Obama. And Barack Obama gave a passionate plea to our younger leaders: reject cynicism and get to work changing what needs to be changed. Now, they talk about Gen Z and millennials represent nearly half of the voting electorate, and they represent the future leaders of our party. This year, a historic wave of them are running for office. We're proud to share that we're officially supporting 100 Democrats with backgrounds in science and healthcare who identify as Gen Z or millennials who are we're funding this this year. There are OBGYNs, nurses, and doctors who are standing up against the anti-abortion organizations and providing the information to show how these abortion bans are threatening the lives of women and babies. I would encourage you to get their newsletter. It's info@e.314actionfund.org. The Washington Post has an article, Forget Trump's IV Promises. The GOP's record shows contempt for fertility care. As always, pay more attention to what politicians do than what they say, is the end of the quote. The Republican ticket is hemorrhaging for women and voters. One reason is that the party's approach to reproductive choices, including both to stop a pregnancy and to start one. After all, the Dobbs decision not only enables Republican-controlled states to ban abortion, it also jeopardizes the legality of treatment for Americans suffering with infertility. Another article, the Atlantic article by David A. Graham, entitled The GOP's Pro-Family Delusion. It's entitled, Trump and Vance have shown that they have no idea how to help people care for children once they're born. Today, Republican Party aspires to be a pro-family movement, but has struggled to turn that desire into much more than a plea for people to have more children. Graham goes through comments by Trump and says he did his usual confusing and rambling comments since he could not answer the question whether and how he would make childcare more affordable. I'm ending this podcast with these comments, but I will give you a summary. But I'm saying this. There is only one choice in November. That's Kamala Harris and Tom Walz, and all the hundreds of Democrats that are running for office to establish the reproductive rights to the citizens of the United States. So let me conclude by saying these lives are at risk. This podcast has examined the devastating effects of abortion bans in red states, focusing on Arkansas as a case study. The strict abortion laws had led to a maternal health crisis, endangering women and newborns in underserved areas. Women face limited access to obstetric care, and hospitals are shutting down their birthing units, forcing patients to travel long distance for essential care. Men, often silent on the issue, are beginning to speak out after witnessing the impact of these laws on their partners and families. The document highlights, and that's what I'm saying, the document I've written for this podcast highlights personal stories of suffering, the lack of government support for maternal health, and the growing movement to restore reproductive rights across the nation, urging voters to support leaders who will prioritize women's health in the upcoming elections. So thank you for listening. I think it's an extremely important issue. You have it. Another episode of Hot Topic Bold Talk is in the books. We journeyed through today's discussion, uncovering diverse perspectives and shedding light on a very critical matter. A massive thanks to all of you that are my listeners. I really appreciate you, and I'm so glad you're a part of this adventure. Feel free to drop your views in the polls and the Q&A section. It's really important for me to hear from you and know how you feel or what you think about my podcast. Gear up for more intriguing discussions in our next episode. Until then, stay connected, stay engaged, and let's keep those conversations buzzing. Thank you.